Polish radiology during the interwar period 1918 to 1939. The First World War, which ended on the 11th of November 1918, dramatically changed the face of Europe and the world. Poland, which had lost independence in 1795 and had been divided between three neighboring empires, Prussia, Russia, and Austria, returned to the political map of Europe. It was not easy to determine the borders of the restored country. For that, it was necessary to hold referendums and conduct military operations. The process ended in 1921. Independent Poland witnessed rapid advancement of radiology. More and more healthcare facilities were equipped with X-ray machines, and the number of commercial laboratories increased continuously. The group of doctors specializing in radiology was growing, and there was a need for effective training of radiologists for the new laboratories. To meet the demand, Poland's first chair of medical radiology was established in University of Poznan in 1921. Karol Mayer was appointed for the position of the chairperson and received the title of professor. As a result, he was the first professor of radiology in Poland. Two X-ray institutes were established in Warsaw. The first one was founded in 1921 and the second in 1928. Also in Warsaw, a radiology department was created at the University Dental Clinic. The Polish Medical Society of Radiology was established in 1925 to meet the growing needs connected with scientific research and to enable sharing of experiences in the radiology community. The person who most effectively engaged in these efforts, Grudzinski, Karol Mayer, then the only professor of radiology in Poland, became the first chairman of the Central Board. The scientific journal entitled Polish Radiology Review was launched in 1926. Zygmunt Grudzinski, who came up with this idea, was its editor-in-chief. The journal published articles by Polish authors, summaries of major international publications, as well as discussions related to current issues in Polish radiology. Of key importance was the fact that a glossary of specialist terminology was developed, which made it possible to standardize the language used by radiologists in the daily practice, in educational materials, and in research papers. Notably, all entries were published in Polish, German, French, English, and Latin. A lot of attention was paid to the specialist training for medical professionals and to certification of their skills in radiology. The Polish Medical Society of Radiology defined the rule that a specialist diploma could be obtained after 3 years' work in a large radiology facility, followed by an exam held before a special commission. This rule was applied even before the Ministry of Health adopted the related regulation. From 1928, at the request of the Society, mandatory courses in radiology were introduced for medical students. Starting from 1931, the Society annually organized comprehensive training courses with lectures given by eminent radiologists. Of great importance for educational purposes were the new course books, published between 1923 and 1931. Here, we should remember that the first Polish course book in radiology intended for medical professionals appeared in 1900, and the first textbook for radiographers was published in 1901. Similar significance was attached to the training of radiographers, in those days referred to as X-ray laboratory workers. In addition to numerous specialist courses, a separate school was established for them in Warsaw in 1927. It is a notable fact that the latest European and American guidelines on safety in radiology were being implemented in such areas as protection against X-rays, the safety of electrical installations in laboratories, storage of X-ray films, which in those days were highly flammable, and finally in the quality control procedures which were then introduced for the first time. From the start, efforts were made to establish good relations between radiologists and medical professionals of other specialties. During the interwar period, many publications discussed this issue, and numerous joint meetings were organized. The Polish Medical Society of Radiology actively sought to promote such labor-related issues as satisfactory remuneration, reduced working hours, and the option of early retirement. Initially, radiology laboratories in Poland were equipped with instruments made by German companies and later also by French and American manufacturers. Over time, attempts were made to enhance the equipment and to manufacture X-ray machines domestically. In 1912, the company Trojanowski and Markson, operating in Warsaw, launched production of the first Polish portable X-ray machines. From 1925, X-ray apparatuses were also made by Wozniak Company. In 1934, a large factory Rurix producing X-ray tubes was launched in Warsaw. A number of smaller plants manufactured X-ray machines from foreign components or simply assembled the machines using parts supplied to them. Some companies also produced accessories or components for X-ray equipment. As regards radiological technology, a very important event in the history of radiology, largely overlooked by historians, took place in 1933, when Stanisław Januszkiewicz from Vilnius introduced a collimator with test area illumination. It is now applied in every X-ray machine. In 1935, the inventor obtained a patent. Production of materials for radiology was initiated in Poland in the early 20th century by the photographic paper factory launched in Warsaw by Piotr Lebedzinski. One of the pioneers of radiology in Poland, he is also remembered as an inventor in the field of photography and cinematography. In 1933, the factory was restructured and modernized, and its name was changed to Photon. It manufactured films and reagents for radiography. In 1933 and 1936, other companies with a similar profile were established: Photo Factory in Warsaw and Alpha Factory in Bydgoszcz. Radiographic contrast agents were produced in interwar Poland as well. Barium sulfate for gastrointestinal examinations was manufactured from 1923 by a chemical factory in Kalisz and from 1927 by chemical plant Ludwig Spies and Syn S.A. In the 1930s, the factory owned by Nazirowski produced Tenebro, a contrast agent for urography. Towards the end of the interwar period, radiology was well established, among other medical specialties in Poland. Major hospitals were equipped with X-ray machines, and there were also many commercial laboratories. The fees for examinations were high. The presentation shows typical prices from the period between 1930 and 1939. For comparison, a mean salary earned by a qualified worker was 95 Polish zloty, and by an office worker, 280 Polish zloty. According to Small Statistical Yearbook for 1939, notably, besides standard imaging or X-rays, a variety of examinations involving the use of contrast agents were performed, such as urography, myelography, arteriography, arthrography, cholangiography, and cerebral ventriculography. At the same time, own novel diagnostic methods were introduced, some of them groundbreaking on a global scale. In 1929, Zygmunt Grzyński described a new method for locating metallic foreign bodies in the eyeball. It was widely used, not only in Poland, before computed tomography was introduced. The method of indoor radiology, which was a novelty globally, invented in 1929 in Warsaw by Bronisław Sabat, and subsequently patented. X-ray images were taken on films inserted into the lumen of the esophagus, stomach, or rectum, using specially designed holders. In 1930, Tadeusz Rogalski carried out the first Polish radiological examination for the needs of forensic medicine. As a result, it was possible to determine the location and to extract the bullet and even to identify the perpetrator. Of course, examinations of patients with gunshot wounds had been performed in Poland since 1896. In the 1930s, Adam Elektorowicz from Warsaw began experimenting with arteriography. Initially, he used dogs for his research. He performed aortic punctures and cut-downs to access the femoral arteries under general anesthesia. He used thorotrast as a contrast agent. At the same time, the first cerebral arteriography in Poland was performed by Felix Oliński, Zdzisław Kwiatkowski, and Antoni Szczerbo in Vilnius. As a reminder, the first radiological examination to visualize arteries was performed in Vienna in 1896 by Haschek and Lildenthal. They used Teichmann's mixture, developed by Professor of Anatomy from Krakow, between 1931 and 1939. Routine radiological examinations were introduced at the University Clinical Hospital for Internal Medicine in Lviv for the diagnosis of tuberculosis. A mobile anti-tubercular clinic was also organized there. It traveled to nearby villages with a portable X-ray machine. A similar campaign was also conducted in Vilnius. In 1937, mathematician Stefan Kaczmarz published an article where he presented an iterative algorithm, also known as the Kaczmarz algorithm, which currently is used in reconstructing images in computed tomography. In the late 1930s, Ernest Matuszek from Warsaw started his research on the feasibility of layered images of curvatures. In 1949, he presented successful photographs of a plaster model of a facial skeleton taken with an X-ray unit of his own design. In fact, these were pantomographic images. In Lviv, radiologist Emil Meisels, working together with the world-famous mathematician Hugo Steinhaus, created an introvisor, a device for computing the location of foreign bodies within the body. They patented the invention in Poland and in the USA in 1939. Notably, during the interwar period, X-rays were used in Poland for purposes unrelated to medicine as well. In 1931, the metallography department of the Mining Technology Academy in Krakow launched a radiology laboratory to enable examination of metal parts such as castings and welds. A year later, a similar laboratory intended for industrial purposes was launched at a car factory in Czechowice near Warsaw. As a reminder, X-rays were first used in Poland to detect defects in various materials in 1896. In the 1930s, during his scholarship at the Rockefeller Institute in New York, Ludwik Hrobak conducted research on crystal structure, which he had begun in Poland. The results of his work were published, and they were of fundamental importance for the application of the theory of resonance in quantum mechanics to the issues related to the structure of chemical compounds. His findings were cited by the Nobel Prize winner Linus Pauling. In 1933, Hrobak returned to Poland and continued his world-class crystallographic research. He was also extremely skillful in designing enhanced X-ray devices. He built equipment enabling structural and spectral X-ray imaging. From 1935, radiographic examinations of paintings were carried out for the conservation studio at the National Museum in Warsaw. In 1937, a dedicated apparatus was purchased for this institution. Between 1918 and 1939, the Polish Medical Society of Radiology established close cooperation with radiology communities in Europe. It was one of the founding members of the All-Slavic Union of Radiologists, which brought together specialists from Czechoslovakia, Yugoslavia, and Poland. Polish radiologists reported their achievements during congresses and symposia held in other countries. Participation in international radiology congresses was particularly important. The first one was organized in London in 1925. Only a few Poles attended. Starting from the Second Congress, in Stockholm in 1927, official representations of the Polish Medical Society of Radiology were in attendance, and Polish radiologists presented their own works. The Ninth Congress of our society was to take place in 1939. These plans were thwarted by the outbreak of World War II when on 1 September, Nazi Germany invaded Poland